Hi, Healthcare in Germany by Shanna Nichols. If you're in Germany, you live in Germany, everyone must have health insurance. And this is based on four basic principles. Compulsory insurance, which is everyone must have statutory health insurance, provided that their gross earnings are under a fixed limit. Anyone who earns more than that can choose to have private insurance. Most people do have the statutory insurance, SHI. Healthcare is financed mostly from the premiums paid by insured employees and their employers. Tax revenue surpluses also contribute. In the German healthcare system, statutory health insurance members jointly carry the individual risks of the cost of medical care in the event of illness. Everyone covered by statutory insurance has an equal right to medical care and continued payment of wages when ill, regardless of their income and premium level. The premiums are based on income. This means that the rich can help the poor and the healthy can help the ill. If you are employed in Germany by a company, that is, you are on the payroll, you may be eligible for SHI. How much you pay depends on how much you earn. Your employer pays a share and the rest is automatically deducted from your wages or salary. The insurance company issues you a card. When you go to the doctors or the dentist or hospital or anywhere you're getting care, you present the card, and that's it. You get your treatment and your medication, and the insurance company pays for it. SHI are also for other people, such as those registered as unemployed, which is a good example, and their premiums are paid by the relevant government. Another fact about SHI is that they must accept people who cannot get private insurance. This moves us on to private insurance. Private insurance is also referred to as PHI, and it is insurance for everyone else. It too is a normal insurance policy, so how much you pay will depend on how much of a risk you are. That means your age and the health that you are in. If you are young and healthy, your premiums will be lower. In this case, if you seek medical treatment, you let them know you are privately insured. They will send you a statement that must be paid, and in return you make your own claim to the insurance company. There are different ways of doing this, and they do allow installments on expensive care, and if it is a procedure that is expected, you could get a rundown of the cost by your doctors. PHI covers some benefits that SHI does not. It also gets you access to some better amenities and covers some copays for other services. 11% of the German public is covered under PHI. So what is covered? Well, it is pretty comprehensive. It includes services as seen on the screen as preventative, mental health, hospitalizations, rehab, outpatient, hospice care, dental, eye care, physical therapy, and sick leave. There are other services that are covered but may be covered a little slightly different, and that includes accident insurance, which covers things like medical services needed for work-related accidents or illnesses, and includes payments in the event of work-related disability or death. Accident insurance is also compulsory for employees, but it is funded solely by employers. There's also statutory pension funds, which are funded in equal parts by employees and employers. These funds are used to pay retirement pensions, disability pensions, and rehabilitation costs for employees. And there's also long-term care insurance. It's kind of new to the German healthcare system, and it covers parts of the cost for nursing care and assistance if these services are needed. When looking at the cost for healthcare in Germany, about 13% is from out-of-pocket expenses. Public spending is 72% of the total, and 57% of that is from SHI. Employees pay an 8.2% tax on their wages up to 47,250 euros, and anything above that is exempt. The employer matches that with a 7.3% tax from employers. Now for PHI, it's slightly different, and one thing to note is half of the insurances available in PHI are for profit. And so because of that, and I don't have an exact amount, but employees do contribute a higher percent of their wages. But for employers, the contribution is the same. On another note, it's also known that competition is encouraged between the PHIs and is tightly regulated for the public. Germany's percentage of medical cost is 11.3% of the gross national product. They do also experience co-pays for services, which includes prescriptions, which is usually between 5 and 10 euros. Hospitalization costs are 10 euros per day. Medical aids such as walkers, canes, devices is usually 5 to 10 euros. And the deductibles vary by plan. Outpatient medical care is usually provided by doctors that belong to regional associations, either solo or as group, that negotiate their contracts with the various sickness funds. In the SHI, half the doctors are family practitioners and half are specialists, and you are able to pick freely. There are some encouragements with some SHIs that give you an incentive to, as we know it as, get referrals, but that is not usually practiced. There are some limitations for the doctors, though. They are only allowed to see a certain number of patients and only allowed to do a certain number of treatments for which a doctor can be paid for. And if they go over that, then they are subject to not getting paid. The hospitals belong to the Hospital Federation, and they represent the central and regional associations of the various bodies running the hospitals, such as cities, religious organizations, not-for-profit associations, and other private sponsors. Public hospitals make up about half of all the beds, while private not-for-profits account for about a third. The number of private for-profit hospitals has been growing in recent years, remembering that half of the PHIs are for-profit. All hospitals are staffed principally by salaried doctors, which are very similar for us as internists in our hospitals. And they are not usually allowed to treat outpatients. Not usually. Senior doctors can treat privately insured patients on a fee-for-service basis, and hospitals can also provide certain highly specialized services on an outpatient basis. This is a good time to go over the structure of the German healthcare system. And I'll start with the Federal Ministry of Health, which is federal, is responsible for policy making at the federal level. It includes tasks developing laws and drawing up administrative guidelines for the self-governing activities within the healthcare system. The Ministry of Health directs a number of institutions and agencies responsible for dealing with higher level issues of public health, such as the Federal Institute for Drugs and Medical Devices and the Paul Ehrlich Institute. The Federal Institute for Drugs and Medical Devices, they make decisions concerning the approval of pharmaceuticals, whereas the Paul Ehrlich Institute is responsible for approving vaccines. Now, when it comes to matters concerning statutory health insurance, the Federal Joint Committee is the highest decision-making body within the self-governing healthcare system. And remember, this is most of Germans, 86%, at least 86% belong to the statutory health insurance. And it includes members representing doctors, dentists, therapists, the insurers, hospitals, and patients. And as the central entity of federal level self-governance, the committee makes decisions concerning which medical services will be covered by the statutory insurers and what form that coverage will take. And they are also partly responsible for healthcare quality assurance. They are supported in this role by others, but mostly by the Institute for Quality and Efficiency in Healthcare. The Institute assesses benefits and risks associated with treatments and diagnostic procedures. It does so by analyzing the available scientific data on selected topics. The results are then to be taken into consideration when making decisions concerning healthcare. It is possible to ask questions about medical research in a certain platform. Now, having said this, one thing I did want to mention, and I'll do that at this point, is that the government chooses reference pricing to get people to choose cheaper drugs. Insurance will pay for the cheapest drug in its class. If a patient wants another one, they will have to pay the difference. Some final notes I would like to add. When you have to stay in the hospital for overnight, it is considered inpatient. And when you are inpatient, there are additional fees charged for accommodation and meals that are not covered by statutory insurers. These fees are stipulated in a contract between the patient and the hospital before the treatment is carried out. Also, in addition to inpatient treatment in hospitals, there's also inpatient medical rehabilitation. And these rehabilitation facilities provide treatments that help people to regain their independence and improve their fitness after getting over a serious illness and are recovering from intensive treatment. And these may include physiotherapy after a hospital stay, following surgery, or for many other reasons. There are also rehabilitation facilities for people with mental illnesses and addictions. One thing noted is access of care is considered exceptional in Germany. 3/4 of the population are able to get an appointment the same day or the next day if they need to be seen with a medical issue. They are also above average in the number of doctors and nurses, but there is some concern because there is a salary difference between primary practitioners and specialists that they too will soon have a shortage of family practitioners. Some of the cons that were noted is that as far as technology or diagnostic machines, they are well below average in the amount that they have available. There are also some concerns of gaps of knowledge with the doctors and patients. In other words, because they're they're spread out so far from each other, many doctors don't know what a patient has been diagnosed with or what they have been treated with. The other issue is the self-employed, and these are people that pay for their insurance but are also having to pay their tax for any employees that they may have, and they end up paying a lot more for medical care. Last but not least, fee for service, which is how the physicians are paid, encourages more care. And in this type of health care, doctors get penalized for doing too much. I'd like to thank you for your attention and time.